Curling now enters the Sports Weekend spotlight.
Good evening, curling fans across Canada, around the world. A lot has changed in 24 hours, Colleen, since we last talked to the curling nation. Here's what we know, obviously, right now. 4 positive cases across 3 teams in the Calgary curling bubble and 4 teams deemed close contacts. Obviously, a high level of concern tonight, Colleen.
You know, and when you think 24 hours ago, our biggest concern was that Canada's Brendan Bottcher failed to qualify for the semifinals. Well, then we wake up to the news this morning and it was a whole other story. Now the concern is for the people who tested positive, plus, as you mentioned, the 4 additional teams they had close contact with. Of course, what we do know now is that everybody in the bubble is awaiting the test results.
No question. Yeah, and like you say, Colleen, of course, it was Scotland defeating Canada. And then about an hour later, that's when we found out that everything was put on hold. We'll put up a board right now of some of the information that was relayed to us, to the teams, to the curling world, that everything was put on pause, that teams were going to be tested this morning, Colleen, but not only teams, every single person inside that hotel isolating in their room, administered tests this morning. We know that those 4 positive cases, asymptomatic, but of course, like you said, the waiting game right now is what we're waiting on.
It is a waiting game. Of course, this is a story that is just in constant flux too. And they had the news conference earlier today that we were both on, right, and they let us know that this is the last announcement for today, but there is that possibility that there might be 3 games tomorrow, right?
Yeah, we'll get into that. So let's actually listen to Scott Arnold from the World Curling Federation when he was asked, are you going to finish this thing? Here's how he responded.
We have to wait for the results to come back first. They could be coming back late tonight, early tomorrow morning. We are trying to schedule games for tomorrow and get back on schedule. And it could be anywhere from, we could have 3 draws tomorrow to try to declare a world champion. But it's obviously going to be our chief medical officer will help us make that determination and just see what the results come back as from the testing today.
So, you hear the potential of 3 games tomorrow, but you're waiting for results, Colleen, as a champion who has been in these situations. What are the curlers thinking at this point?
Well, for sure, no one's been in this situation before. This is uncharted territory. I was really surprised when they said they would try to get 3 games in tomorrow. There are a lot of test results that need to come down. Of course, they did tell us during the conference earlier that they fogged and did a deep clean of the entire arena. The whole question of asymptomatic people, though, and whether those test results show that is one of the big question marks. You would be really nervous going to bed tonight, not knowing, first off, the whole fear about COVID-19 would be front and center in your head and not the game. Right. And then whether or not you're going to get the call in the morning that you're going to play a game. Right. Well, tomorrow almost seems too early, considering Nolan Thiessen told us that his next order of business was to go around and deliver food to everybody.
I mean, doesn't that just speak to the situation inside the hotel right now? Is everybody's locked away, anxious? Of course, we've been hearing from the curlers. I've been inundated with messages. We're going to focus on facts tonight, not speculate. But what I'm hearing, Colleen, from the curlers, high level of anxiety, not a lot of sleep, a lot of unanswered questions. And one of the big ones that I asked of Dr. Bob McCormick was, how did this happen? And those protocols, the testing protocols. Mm-hmm. So teams arrived anywhere from a week to 9 days in advance of the event. They were exempt from that 14-day quarantine. They had tests for those first 5 days. After that, they haven't had a test since April 1st. So I put that question to Dr. McCormick. Here's how he answered in regard to whether or not they thought their protocols were airtight.
We had a lot of discussion with experts and also with Alberta Health to come up with protocols that we felt were safe to establish a clean bubble and then because we're a sport that is not a collision sport, not heavy sweating and breathing on each other in close contact, close quarters. Our protocols we felt were appropriate to maintain a safe environment. If things change, if somehow the virus gets into the bubble and we become aware of it, then we have to sort of deal with it.
I think he also used the word at one point that they're open to modifications. Something else he said that I also found interesting was that there are unknowns that we need to sort through, but he was confident
Right.
that it's still going to resume.
Yeah.
There's still so many unanswered questions in all of this. And I know we're going to deal with this for the whole show, but one thing you had to feel sorry for, Nolan Thiessen and Danny Lamoureux from Curl Canada did a lot of work in this lead up. I know as a curler, I got the first draft of what was going to happen way back in November. And it did look, as you said, airtight. Although if there's one thing we have realized during the pandemic, you should never use the word airtight in anything, because the disease plus the variants make this very, very difficult for anybody to ever describe anything as airtight. But anyhow, here's Nolan Thiessen when I talked to him.
Right.
Nolan, I know how much work has gone into all of this. Can you tell me your reaction when you heard the news that there were positive tests?
I called the doctor and said, come meet me in a secure location, is what I did. I obviously got it. Friends, colleagues, teammates, our broadcast partners, just completely gutted, but we're going to figure out what happened and see if we can still complete the season.
So striking to me, Colleen, the human toll of all of this. They're exhausted. People haven't been sleeping. You saw it right there. Nolan Thiessen just doing his best, trying to figure it out.
The exhaustion factor, because I think, what time did they send out the announcement about the positive test? Was that around 1:30 a.m. Eastern or so?
Yeah. Yes, it was.
And Dr. Daniel Kelton, who's the doctor on site, she spoke about that during the news conference, that the anxiety levels of people, they do have mental health experts there at the disposal for the curlers, the coaches, the support people that are there too. This would be a stressful time to be inside the bubble right now because of all the uncertainty.
Compounded by the fact that a whole new wave of curlers are supposed to move in tomorrow for the Slam event, which is supposed to start on Wednesday. Let's move on. Let's go to the medical expert, somebody across Canada people will recognize, Dr. Isaac Bogoch, an infectious disease specialist. Doctor, it's great to see you. No stranger, of course, to the television. You've been so knowledgeable throughout all of this. The last time you and I had a conversation, we were talking about the Toronto Blue Jays and a bubble at the Rogers Centre. You told me bubbles are great if they're airtight. What do you make of what we're hearing?
Yeah, of course. When we have to, when we're thinking about a bubble, you always have to think about what exactly makes this bubble. And not every bubble is going to be perfectly airtight. These aren't really hermetically sealed. There's always going to be some movement in and out of the bubble. And of course, whenever you're bringing people into the bubble, you've got to make sure that they follow and adhere to strict protocols to make sure that you don't bring the virus in. The other thing, though, is it's not just a matter of the obvious of reducing the likelihood of bringing COVID-19 into the bubble. It's creating policies and protocols such that if it is brought into the bubble, you significantly reduce the likelihood that it can spread within. And you've seen several success stories, right? You saw the NHL in Edmonton and Toronto conduct a very safe and effective bubble. You saw the NBA do it in Florida. You saw Major League Soccer do this in Florida as well. Like, those were very, very successful. And, they had tight protocols to prevent the entrance of COVID-19, but also if there was a positive case, you saw very little, if any, transmission within. It'd be interesting. I don't actually know the full details of the protocols here. I have some sort of peripheral details of it. And it looks like it's good, but it looks like clearly cases were brought in and now they're using their protocols to prevent any further transmission within the bubble.
Well, Dr. Bogoch, in the first 3 events in this bubble for the Scotties and the Brier and the mixed doubles, they conducted 1,500 tests and there were 0 positive. When the international event, the World Championship started, now we have these 4 positive tests. There was not a 2-week quarantine for the curlers coming in from overseas. Do you think that's a factor?
Well, you can shorten that 2-week quarantine to about 7 days, and you can really use diagnostic testing to help out with that. So, for example, in the United States, the CDC basically says if you've had an exposure, you can isolate for 7 days, and if you have a negative test on day 7, you're good to go. Now, of course, nothing is 100% perfect, but that's still a really, really good way to do it. In other protocols, in other sports, for example, they had people isolate as best as they could for a few days before they traveled to the bubble. They had pre-travel testing. And then when you got into the bubble, you would isolate for about 4 days, depending on the sport, depending on the protocol. You'd isolate for about 3 or 4 days in your room, and of course have testing within the bubble. And if your tests were negative on about day 3 or day 4, then you're allowed to function in the bubble. But even when you're allowed to walk around freely in the bubble, you still have to wear masks. You still couldn't congregate in large settings. Meals were very carefully done. There was no, buffets where everyone would crowd around, so food would be served to you at a table. People would be spaced apart. So there's a lot of care and attention to every aspect of that. And I'm not saying they didn't take care and attention in cases like this, right? Listen, it's just sadly, it's a matter of time. Something's going to happen. Something's going to happen. And we saw that with soccer as well. There was a case that was brought in, and of course it was quelled very quickly. And it sounds like they're taking the appropriate steps to quell this very quickly as well.
That being said, when you hear, Dr. Bogoch, of 4 cases spread across 3 teams, what do we know from that? Obviously, it's spreading.
Yeah, absolutely. So what you have to do is really do, strong outbreak investigation. And I'm sure they have a local epidemiologist or infectious diseases specialist or infection prevention and control specialist. The Venn diagram kind of overlaps. Someone who's knowledgeable on how to manage an outbreak, and you do a very thorough investigation. You look at what are the potential exposures. You look at who had possible risk factors for being exposed to this. You isolate everybody. You test, and you come away. And you know what? I wouldn't be surprised if you find another 1 or 2 tests turn positive, because some people might still be incubating the virus. The key thing with very frequent diagnostic testing is it's really sensitive. You can often catch people before they're able to transmit the virus to others if you do testing frequently enough. Your test becomes positive, and if you get that early enough, you might be able to identify and yank that individual out of interacting with others, and prevent this outbreak from spreading further. So between isolating people, very thorough contact tracing, very frequent diagnostic testing, they'll be able to handle this for sure.
So you think it can go on?
Oh yeah. Oh, absolutely. But by no means can it go on like status quo. Like you've got an outbreak. You've got to be careful here. You've got to definitely pump the brakes and manage the outbreak. But I'm sure they've done this before. This is outbreak management 101. And quite frankly, I'm not saying it's easy, but it's easier when you have the resources available to you. So you can guarantee that no one's going home, right? You've got a captive audience. They're all in a hotel. You know who's there, where they are at every point in time. You can ensure that these people are isolating in their room. You can get diagnostic tests. It's kind of like, don't laugh me off of this call, but it's kind of like a dream come true, right? If you're doing an outbreak response and you know that every single person is going to be 100% adherent to your recommendations, you can guarantee where they are at every given time. This is great. You can isolate it. In the real world, outside of this, who knows what people are doing? They're out of their houses, they're going grocery shopping, they're interacting with other people. This is an ideal environment to get this under control. And now, obviously, life happens. There probably will be additional cases. You certainly have to ensure that there's very strong communication so everybody knows what the plan is and what's expected of them, and the frequency of testing and the duration of time that they're supposed to be in isolation in the rooms. But it's small, and you can keep it small. But the key here is, there's protocols in place to really ensure that this doesn't spread farther. But don't be alarmed if you see another handful of cases, because some people could be incubating it and they haven't turned positive just yet.
Dream come true, but what concerns you at this point? When we hear that there are 4 other teams that have been in close contact, is that concerning?
Yeah, it could be more widespread. It certainly could be more widespread, and I don't think it would come to anyone's surprise if there are additional positive cases with additional people who might not have had any, obvious contact with each other. Listen, the variants of concern are here. It's not like they're a minority of cases. They are, overtaking the conventional COVID-19, for lack of a better word. They're much more transmissible,
Right.
and there's just much less wiggle room, right? You just don't have as much wiggle room for error. I mean, outbreaks will be larger. Sadly, people will be, on average, they'll be more symptomatic with this one compared with the other one. So when you hear of people being completely asymptomatic, obviously that's great. We don't want anyone to have symptoms, but I wouldn't be surprised if you've caught people early in the course of their infection. Some people may end up developing symptoms because the tests that they're using are so sensitive. You often catch, and sometimes testing is so frequent, you often catch people before they start to develop symptoms.
Right.
And the key thing here is if you have very frequent diagnostic testing, you identify these cases early, you identify them before they have symptoms, and you identify them hopefully before they're more contagious so that you can isolate them. So the outbreak, and that's the whole point of this frequent testing. You're never going to prevent an outbreak, but instead of having an outbreak, you'll have an outbreak with those frequent tests.
But going forward with the safe way, because I know Dr. McCormick, who's the chief medical officer for the bubble, said there could be modifications going forward for the next 3 events. Would more testing, even daily testing, even if it was a rapid test, would that be the ticket here?
Yeah, you absolutely. That could certainly be a component. And again, it doesn't make it 100% safe. You're just adding incremental levels of safety. You're adding the potential to more rapidly identify a positive case and isolate a person before they're contagious and can transmit to other people. So daily testing, and even in other sports, in other professional sports, for example, in the NBA, you'll have people tested sometimes multiple times a day. So it can happen. It does happen. A lot of this is related to the resources that they have available, but certainly more frequent testing would be on the table as a potential option.
Right.
Okay, doctor, I told you we would have you on for 5 minutes. I knew it would never go 5 minutes. Is there anything else you want to add that you think is important to this? A high level of concern and a lot of questions from Canadians in Calgary in a curling bubble and the public at large. Should they be concerned about this?
No, I mean, first of all, I always divide this into a few things. Number one, player safety. You got to make sure everyone's safe. Like, that is paramount. That's priority number one. Make sure everyone's safe. So make sure that there's the tools there to ensure that they're isolated, that those who are infected get the medical care that they need and deserve, and that the risk to others is eliminated with the protocols in place. The second thing is not just player safety, but population safety. You have to run this ethically. You cannot contribute to community transmission by conducting your sport. And by clamping down on this quickly, I think this doesn't pose a greater population risk, right? Everyone's isolated in their hotel rooms. You're not going to have a massive outbreak that impacts the city of Calgary or Alberta, and it doesn't draw tremendous resources away from them looking after the general population. So player safety and public safety are paramount, and it sounds like they're adhering to both of those principles.
They are doing both of those for sure, and all the
Absolutely.
players are quarantined and freshly tested. So,
Perfect.
Doctor, I know you're a busy man, so we are grateful for your time. Good to see you. Be well. I'm sure this isn't the last time we'll talk. Thank you.
Look forward to it. Have a great day.
Okay, thank you. So knowledgeable, a voice of reason. That's what we need right now, no doubt, Colleen.
yeah, that brought a lot of relief for me just hearing him say that, when you manage it, and I know they are managing it, both the World Curling Federation and Curl Canada, that now this could go forward in a safe way. Again, when I heard 3 games tomorrow, I was sort of, wow.
Yeah.
But now I feel, after listening to that breakdown, that I see how it could go forward.
Yeah, really smart, really measured, super knowledgeable. Thank you to Dr. Isaac Bogoch. Of course, Brad Gushu has been in Calgary for some time. I understand he's at an Airbnb at this point, but will be moving back into the bubble to prepare for the Grand Slam, and he joins us now. Brad, you just heard the doctor. Good to see you. What do you make of what the doctor ordered for us just now?
Boy, he sounds smart. That's one thing I get from it. But you know what? A lot of the things that he mentioned in there actually are happening in the bubble. So a lot of the protocols that he had in place or talked about are in place in there. I think from a player standpoint, I know for us, when we went to the Brier in the mixed doubles, we felt very safe in there. And, you know, it may not be perfectly airtight, but we're living in a country right now where this virus is raging. And the opportunity that we have to go into the bubble is probably safer than just about anywhere else in the country. And I think it would have been kind of foolhardy for Curling Canada and the World Curling Federation to take this on without the expectation of a case occurring. We have that now, and I'm sure that they have a plan in place to kind of squash this and get us back to where there are no cases. So I think we just need to be patient and let them do the work, do the research, do the contact tracing, and hopefully this can go on. But I know from our team's perspective, I think if we get the okay from Dr. McCormick, you know, we're going to feel pretty comfortable and pretty confident going back in.
Good.
What were your concerns when you heard about it? When you woke up to the news that that the bubble had been breached?
It wasn't actually waking up. Brad and I were being late into the night.
Devin and I were texting late last night, and I kind of sent him a message. I said, is it okay to go to bed now, or is there any more news coming? So we learned about it last night, and number one, obviously the concern for the players and making sure that, you know, they're not ill or feeling the effects of this. And the fact that it's asymptomatic is nice to hear at this point, that everybody's healthy. I think the second worry beyond that went to just the kind of longevity of the bubble and the fact that we have the slams coming up and more importantly, the Women's World Championships. You know, my thought went to Carrie and some of the other teams that are, you know, especially some of the international teams that have already traveled over here to get ready for that. You know, they went through that process last year in Prince George where they were there ready to play and the event got canceled. And to have that happen again, man, that would be tough to take. And so that's kind of where my thought process went last night. You know, I do feel a little bit better today and you know, following Devin's tweets about the press conference earlier, and certainly listening to Dr. Bogoch, I feel a whole lot better. And I hope they don't give up on it. I think just try and find this and make sure that it hasn't spread too far. And we do have a chance to kind of refresh the bubble. You know, a lot of these athletes are going to be leaving and it's new ones coming in. So, you know, as long as they can maybe strengthen some of the gaps that are there, if there are any, I think we can get through this.
Well, Brad, you might be able to relate to this. My bias, of course, well, first I want the curling to go on, but my bias being one of the Atlantic provinces where they clamper down and do circuit breakers at 2 cases, that as soon as you hear that, your automatic thought is, oh, we need to shut her all down, right?
Yeah.
That's where I am right now.
Yeah, you bring up a good point. And I think they're kind of doing that. You know, everybody's locked in the room right now in the hotel. They're testing everybody. So they're going to be able to identify how far it's spread, who's affected, and, you know, and then deal with that, I guess, going forward. The worst thing, I guess, for the World Championship is if this is spread to some of the teams that are remaining, and those players and the athletes aren't going to get a chance to compete in the playoffs. I think that would be difficult, but you know, if you can identify and separate those people that have it, that it's spread to, there shouldn't be much of a reason that it can't go on. You know, I love Dr. Bogoch's comment about, you know, player safety is number one, and I agree with him there, but you have to worry about the outside public as well. And as long as we're not having an impact on the greater community of Calgary and Alberta, there's really no reason, you know, we can't continue if player safety is put first and foremost, which it certainly sounds like it is.
Great perspective. Two quick things I want to point out. Of course, it's important to know that there are two hotels, a Slam hotel and a World Championship hotel. I think that's important to bring up. Also, on the point of the World Championship, we asked Dr. Bob McCormick about any tweaks. He said, no, I'm confident in the protocol. So it sounds like that's a good situation. Brad, not only do you have the Slam events, but of course, congratulations on the Mixed Doubles Championship. That would mean and means you traveling to Scotland for the World Championship. What do you make of having to travel for a curling event in all of this?
It's a concern. It is, it will be a concern for both Carrie and I. We were somewhat surprised actually partway through the mixed doubles when we heard the Worlds were going to be in Scotland. And then when we won, it was kind of like, oh, now we gotta deal with this. But again, I haven't seen all the protocols for the event over in Scotland. So I can't comment on the safety part. I think the biggest worry for us is the travel over there. But then even a bigger worry is just for us, the amount of time away from home. Carrie's going to be gone for 2 months straight. I'm going to be gone for 3.5 months. I'm going to get an opportunity to see my kids for a very short period of time, but I'll be in isolation. So that's the bigger challenge for us is just being parents and trying to balance living life in a bubble and still trying to be a parent and be a husband and a wife. That's been our biggest challenge.
Wow.
Lot to worry about now as a curler, isn't there?
Well, it's a pandemic. There's a lot to worry about, but we are very fortunate that, we got through 7 weeks without any cases in this bubble. So, they've done an incredible job. I know they're getting a bit of flack, but it is a virus and we don't know everything about it. And we don't know how this got in. It could have came in very innocently you can't put blame right now. I think the important part is identifying where it spread and then hopefully closing those gaps to make it safe or safer over the next 3 weeks.
Great. And I also like to think in these COVID times, and let's just never, I think blame is one of those useless things people do. I mean, you want to learn from lessons, but blaming in a pandemic, I don't know. It doesn't.
Yeah, I'm with you, Colleen. The only situation I could see that is if, some of these athletes just left the bubble and went to a nightclub or something like that. But we know that didn't happen. There's no way that these athletes did that. And they probably followed everything to a T and something happened. So it's certainly not their fault. And I think we just got to be compassionate with them because, they're going through a tough news right now where, they have a virus that you don't know much about and they're having an impact on the World Championship. So, mentally that's got to be a challenge for those guys. And I'm sending all my best and I know our team is sending their best as well.
Were you tested, by the way, today, or do you have to test before the Grand Slam again?
Yeah, so we tested yesterday. We're going to get tested again tomorrow. We enter the hotel for the Grand Slam. We're there for a day, and then we switch to this hotel where the Worlds are being held on Monday. We have another test on Monday, another test on Tuesday, and I don't know if the protocols are going to call for any additional testing. We should learn that, I would imagine, in the next 24 to 48 hours. But again, we felt very, very safe during the Brier and the mixed doubles, just with the protocols that are there. And, I certainly, I'm going to repeat what I said earlier. I feel safer going into the bubble than I would going into, some of the hotspots across the country.
Yeah.
Soph, can we bring in the second half of the championship duo right now before we let Brad go and say, good evening to Carrie Anerson. Look at the champs all together again. Good to see you, Carrie. How are you?
I'm doing good. It's good to hear some good news today, so that's nice.
Yeah. Well, can I tell the two of you were joyous to watch during the mixed doubles. I know this is all about the breach in the bubble today, but you two were just joyous and fun to watch, and your shots for both of you at the next level. You keep saying that about you two, but wow. Let's just say we're not worthy right now. Good for you guys.
Yeah. I'm really good at picking my partner. That's
all right. Well, good choice. I'll put me number 10 on your list. I know your daughter's next, Brad, but all right, let's shove Brad out. Give Carrie her time, Brad.
Thanks, Brad.
Guys.
Yep, good perspective.
Thank you for your time. Yeah. Carrie, how are you doing?
I'm doing good. I'm just kind of slowly picking away at my packing here and trying to pack for 2 months. It's crazy.
Wow. Yeah. Thank you so much for giving us a little bit of time. What was your reaction when you heard the news about the positive tests in the bubble?
I didn't sleep much last night. I cried. It even makes me emotional thinking about it because it was so heartbreaking last year to not be able to represent Canada. So for that to run through our minds again, I was just devastated. I was like, no, this can't happen to us again. And thinking about all those teams that are just flying in as well and getting there. And I was like, oh, this is tough. I just hope that something good will happen.
Yeah. I mean, emotional and vulnerable, Carrie. So thank you for that. Who have you been talking to? Who have you been reaching out to? You talk about a sleepless night. Who have you been talking to over these last 24 hours?
I texted my mom at midnight last night. I was like, "Are you still up?" And she's like, "Kinda." So I told her, and she's like, "Oh no," and she's like, "Don't worry, just keep staying positive." And I try and stay as positive as I can. And then I was just talking with my teammates all day and just kind of giving each other updates. And we're still going as we're leaving tomorrow, so we're gonna do our thing and pack for however long that we're gonna be there for. So it's just taking one day at a time.
Yeah. Were you reassured by some of the comments that we played earlier, and you might have already heard or seen other tweets from Bob McCormick, the Chief Medical Officer, and Scott Arnold from World Curling Federation, that they really want everything to continue, and almost each bubble will be a new start. So were you encouraged by hearing that? Because the women's world is still so far away.
Yeah, it's still quite a ways away. So I was like, well, maybe we could still work on that. And if the Grand Slams end up having to be canceled, like just really wanting that chance at the World. So hearing that from the doctor is great news, and it definitely makes us have a little more breathing room, and that they are trying their very best to make this work for everyone instead of just pulling the plug right away. So that is truly, we appreciate all the work that everyone's doing to make this a goal.
Carrie, can I ask you about the human toll of this? You're a mother. We know how much your daughters mean to you, the line of work you have, but you're a competitor. You want to win, and yet you have to balance all of this and keep perspective. Can you tell us about how challenging that's all been to wanting to play the game you love in the middle of a pandemic?
It's extremely, extremely challenging. Some people don't see that part of being a mother and leaving your kids at home for 2 months, and even just being a wife and not being able to be at home, or like husband, and every athlete is sacrificing so much to chase their dreams and do what they love. Residents at work miss me like crazy, and my coworkers, and I really can't wait to get back to work because I miss them just as much as they miss me. And I just sat down with my girls today, and I was just like, girls, mommy leaves tomorrow, and it's going to be for a very long time. And they said to me, will you be home in time for my birthday? I was like, it's not until September, so I'll be home for your birthday. But they don't also quite understand how long that is, right? So just trying to explain to them, like, I'm going to try and FaceTime you every single day, twice a day, when you get up, when you go to bed. It's going to be a little more challenging when I go to Scotland. that the time change will be tough, but I'm doing my very best. I have so much support here at home with my husband, my parents, and my in-laws and auntie and uncles. Just so much support here that takes that pressure off of me.
Yeah. One little tip, Carrie, what I did, and maybe you've already done this, the longest I was away was about 4 weeks for a curling event in Switzerland. And I wrapped little presents and just hid them in different places, just little cheapy things from the dollar store. There's my motherly tip, little presents to cheer them up. Listen, watching the men's worlds, what were you thinking when you're watching that and recognizing the pressure you probably felt for Team Canada, making sure they qualified those 6 teams? I'm sure you had some empathy and sympathy for Canada losing to Scotland, but what were you thinking while they were, making sure they qualified that Olympic spot?
It is a lot of pressure. And I know for us, we were messaging back and forth and we're like, let's not put pressure on ourselves. You know what? Go out and do our thing. Be Team Anderson. I know we're Team Canada, but let's go be Team Anderson and just enjoy ourselves and take one game at a time and just really embrace it. We're just extremely excited. Every time I talk about this, I just get goosebumps. So I'm just ready to hit the ice and represent Canada.
Yeah, awesome. Well, let's all do what your mom said. Think positively. Will happen, because they're making sure all the I's are dotted and T's crossed as they deal with these positive cases inside the bubble. Carrie, thank you.
Yeah, Carrie, and you show up on this show and you bring all of you and you bring the emotion, and we're so grateful for it. And I know everything we hear, Canadians and all over the world, your fans really appreciate all that you bring. So we're grateful for it, and good luck. Stay healthy and travel safe.
Yeah. Cheers to you.
Thank you so much for having me.
Yeah.
Take care.
Yeah. Wow. To win both championships, the Canadian mixed doubles, I've already got her as a world mixed doubles champ, and the Scotties crown.
I mean, it's a good point, Colleen. Could you imagine over these few months winning 4 championships? It would be one of the more remarkable curling stretches ever.
Yeah.
Incredible perspective tonight from the doctor, from our curlers. And now, of course, we're going to go inside the curling bubble in Calgary right now. We had Mike Harris on last night when everything seemed cool and calm. And there's Jill, and you guys are there. Good to see you both, but you're in separate hotels. So, Mike, let's start with you first. Where are you? What's the scene? And then Jill, we'll go to you to get you to do this thing.
Room 303 at the beautiful Aloft Hotel. Yeah, and we're not in separate hotels, by the way, just separate rooms, which is probably best for all. So,
well, we're in separate hotel from the players, though.
Right.
Yes, correct. Yeah. So we're in the media hotel, and the protocols for us are a little different. We've been tested every other day since we arrived, and as have the TSN crew. We're with the World Curling Federation TV people for this event. And we got tested again today, and I know that all of our crew, the WCTV crews, all came back negative yesterday. So,
good.
We're doing as well as we can be doing. It's it's a hurry up and wait situation. I think that everyone's in at the moment.
Jill.
Yeah, I'm in room 231. Sort of the same thing. Just hunkered down here. Getting updates like everybody else. I hopped in on the media conference today, which was really good to sort of hear some of the answers, and felt a little bit of positivity that the bubble could still continue at some point. That's was my takeaway from it. We've really, I think Mike and I and Kevin and Luke and Melissa Saligo, we've been really enjoying our time here, and it's been really nice to be in a curling venue, even though it's super quiet, especially last night. And just hoping that we can come back Mike and Kevin are planning to stay if the Grand Slams go, and just hoping we can come back for the women's.
Mike, you mentioned about, you're tested every other day, and you and Jill both. So I guess it begs the question, why not the curlers?
Well, again, not understanding or not knowing their protocols. Again, when you look at how long the bubble's been intact for. And I think Brad alluded to it a little bit, where I don't think there's any sense of it being unsafe. In fact, we've joked that it's the safest place in the country, in this bubble, in the sense that, we know that, for the most part, everyone's doing their due diligence and being vigilant about, not, wearing masks, for example. Just, we really need to be careful with what's going on. And I think the thing with getting tested every other day, for us, it just keeps it at the front of your mind,
right,
how important it is to stay vigilant and wear your mask, all those things. So, and until we find out what happened or how, we may never find out how the virus got into the other, or into the players. Who knows, in the hotel, or, there is staff that go in and out of hotels that are supposed to, again, do their due diligence as well. So, until we find out exactly what happened, it's going to be very difficult to, I think your point of blame, it's kind of a useless word, Colleen, right? So everyone's just trying. There's not a single soul here in the hundreds of people that are making this happen who don't want it to continue to happen. So I can't imagine that there's any reason to believe that there was someone who went out, did something they shouldn't be doing. So it's just a question of figuring out what we need to do from now moving forward.
Well, Joe, would you think that might include increased testing?
I think that that's something that we have to leave up to the public health officials. We're not the scientists, we're not the doctors, and we don't know enough about it. Everyone can sit here and try to guess as to what should happen or shouldn't happen or what should have happened. And at the end of the day, none of us are doctors, none of us are scientists, and we don't understand it all. And I think we have to be mindful of that and just leave it to the people who have the expertise.
You guys are both pretty dialed in. We text a lot. We tweet a lot. You're pretty dialed in to the pulse of the curlers. Are you guys hearing from people? What's the level of anxiety? I've heard from people. Obviously, it's unsettling, but can you give us a level of measure here in terms of where everybody's at on the ground inside the hotel?
I think in our hotel, everyone is there's not an anxiety of infection. There's an anxiety of the work, and there's a lot of freelancers here, and I haven't worked in 14 months, so I'm happy to be here and would like to continue working. So there's some of that, but at the end of the day, that takes second. That's behind the importance of the safety of everyone, and I think all of us understand that. So I've been in touch with players off 3 or 4 different teams, and yes, there's definitely some anxiety. The fact that they're not naming names and everything else like that. And even Kevin's been talking to his son Kark, and they just aren't telling people who it is. But there are 3 or 4. I'm sure the players know much more than any of us will ever have a chance of knowing. And so yeah, I mean, I was encouraged by the doctor's words today, thinking that they could maintain the bubble or reestablish a bubble. And particularly moving forward for other events, like, for Carrie and her team at the Women's Worlds, I mean, that's 3 weeks away. Right. They could literally clear out these hotels and start fresh if they really wanted to. Yep. Obviously the Sportsnet shows with our 2 slams, there may be some modifications in place for that as well. A lot of it's going to depend on those 4 men's teams who are in this event and also in the slams.
Right.
The other, however many that 20, the other 20 teams that are coming in, they're going through the same protocol that Brad Gushu described. So I don't have a sense of dread of those teams bringing anything with them. It's the teams that are already here, and that we might need to. There may be some adjustments need to be made for that event, but we're hopeful that things are going forward. That's my view anyway. We're hopeful that things will keep moving.
Yeah, it definitely sounded hopeful after the news conference. Jill, Scott Arnold said that it could be 3 games tomorrow. When will you guys get like a beep or an emergency alert at like 1 a.m. to make sure you're ready for 8 a.m. or what's the protocol for you guys getting ready to broadcast?
Well, for me, I am actually scheduled to head home tomorrow. That was always my schedule. I was supposed to do one of the games this evening. So with Kevin and Mike and Luke still here, it didn't really make sense to rearrange things for me. And I've been cleared to go home. So So I don't know. That's going to be Mike on his phone all night, maybe waiting for the the alarm call.
So, Mike, what happens? An emergency alert comes to you, or?
Well, our lead producer will send us a message as soon as she finds out, right? Yeah. So at the end of the day, there would only be one game in the morning of that Swift US quarterfinal or qualifying game, however they're calling it. Then they would likely run both semis at the same time in the afternoon, and then the bronze medal game and the gold medal game at the same time in the evening.
Right.
So it's, curlers are used to playing 3 games in a day. That's not good. For the curlers, that won't be a challenge. It's going to be a question of whether they'd be happy to play, I'm sure, but it's going to be a question of whether those teams that are left in the bubble or who are still in the playoffs are infected. And we don't know that yet because they only got tested this morning.
Yeah.
Right. The teams that were leaving are the ones who got tested yesterday.
Exactly.
But these 4 teams who were supposed to stay for another few days didn't get tested until this morning. So we'll find out those results later today, and that's when the decision will be made.
So how do those teams prepare? Like they go to bed tonight, assuming that they almost have to assume they're going to play. They have to be ready. What advice would you be giving them if you were coaching those teams?
Right. It's just a question of all that mental training you do, right? What would Ken Bagnall say, Colleen?
He always said, expect the unexpected, and there will be
go.
Road. This is a bump in the road. But Jill, what would you say?
Yeah, you know what I would say to, just do your best to sort of pull out all the stops and what you can control, and do your best to maybe turn off social media at this point. Some players stay on it during a major competition. Some players don't. But I think right now, if you're scheduled to potentially play tomorrow, I would suggest staying off of social media so that you can almost disconnect from the whole thing. Maybe just have one of your support staff be able to contact you to let you know if it is going to happen. And otherwise, like you said, Colleen, just prepare as if you're going to play. So try to go to bed early, be well hydrated, get up in the morning to eat, etc. And yeah.
Well, I will not be staying off social media, and I will not be going to bed early.
Sorry, Devin.
Shocker.
Devin would have thought that was really bad advice, but yeah, you're right.
But I'm also not a champion, and that's why I'm here. Lovely to see both of you. Jill, travel home safe. Great to see you. Take care. Mike, stay safe in there. Of course,
thank you.
Find out a lot in the next 24 hours, but it's great to see both of you. Stay well.
I'm sure you'll know more. I'm sure you'll find out before we do, Devin.
We'll see.
Thanks, guys. Nice to see you.
Yeah,
awesome.
Nice to see you. Yeah, Devin, you've got a pipeline to everybody. I mean,
I need some sleep, let's be honest, and more coffee. Okay, we're gonna get into it here. Some great work being done by all of the journalists in this country who are committed to telling the stories of curling. Colleen, you and I have talked about it extensively. We wish we could be there, but we're not, so we're doing our best. And so, we were all on that call today asking important questions. Great work being done by Greg Strong of the Canadian Press and Ted Wyman of the Winnipeg Sun, and we're all together again. And I wish it were on a media bench, and I wish we were talking about a curling game, but great to see both of you. Ted, let's start with you. What do you make of all of this? My goodness.
Well, thanks for having me to the virtual media bench. Great to be here with you guys again, as I have been so many times at these curling events.
Right.
And of course, I love your show. But what do I make of all this, Devin? It has been a crazy day. And I know, because I follow you on Twitter, that you, like me, you were up until 2, 3 in the morning just trying to piece together what the heck was going on. And then up again first thing this morning and talking to curlers and talking to various people who know what's going on. And here's the thing. Nobody seemed to know what was going on, right? It was just such a difficult situation for people, and surprising, I think, for so many of them, because they, especially guys like, the Team Canada players and whatnot, they've been there for a month already and they hadn't had any issues with COVID-19 somehow sneaking into the bubble. So I think there was a lot of surprise there. I think there was a lot of bewilderment as to how something like that could happen. And, what the heck happens going forward? A lot of the curlers I talked to are people who are looking to play in the Grand Slams, and they are just completely in limbo right now. It's been a really crazy day in the world of curling.
Greg, what do you see the priorities should be moving forward? You know, as we talk about the 2 Grand Slams and the women's worlds, and of course the possibility of 3 games tomorrow even.
Yeah, one of the takeaways I had from that conference call today is just the whole timing issue. I mean, you want to have 3 games on that final Sunday, but we got to look ahead too. And we've got to, I mean, I look at other sports. I look at baseball, I look at hockey. I mean, we look at what the Vancouver Canucks have had to deal with lately, and it's been postponements, right? And in a perfect world, we would kind of bump things back a bit, a few days at least. But I really had a sense they want to finish this tomorrow, and that there is very little wiggle room as far as the slams coming up later in the week and later in the month, and the women's worlds, of course. So, I mean, it's going to be fascinating to see what happens tomorrow, because it's also a lot to ask for the curlers too. I know they're used to playing 3 games, but this is 3 games at a world championship. And it could be, 3 hours per game? I mean, that's 9 hours, potentially 9 hours of super intense curling. I think it's a lot to ask.
Ted, we were licking our chops as journalists to have a media call and to be able to ask our burning questions. You talked about bewilderment. What were sort of the key things going into that you wanted to know? What were the key questions, and did you feel like they were answered as thoroughly as they could be? I thought we got more than I was expecting we were going to get. I don't know what you make of it.
Well, I don't know if we even asked the question that I wanted to know most, which is who is it that has tested positive? Because you want to know which teams are involved to know which teams that are still playing may have been, in the contacts. So that's really the thing that I was really interested in. But also, I think, you just wonder how you're going forward in an event like this when you've already had 4 people test positive. We don't know when they potentially contracted the COVID-19. They've been asymptomatic, but who knows for how long they've been asymptomatic. They've been playing games all week. Now they're testing everyone today who's still in the bubble. How many positives are you going to have out of that? I mean, I think that a lot of what was answered today was kind of predicated on the fact that there aren't going to be more positives. Because if there are more positives, I don't see how there's any going forward with this.
Great point.
What do you think, Greg?
I think, comparing curling to other sports, what we're missing here, I think, is that third party, that players' council, a players' association. I've always thought curling is really needed one. And this is an example, I think, when we look at the bubble and this season as a whole, where they could have used that party to represent the players, to be that communication outlet. Because I'm hearing from a lot of curlers, and they're saying the communication is almost non-existent in some points. And before the event, before this bubble was even put into place, there was very little communication with the top teams as to how it was going to work. And you look at other sports, you look at baseball's return, that was in conjunction with the MLB Players Association. Same with the NHL and its bubbles last summer, in conjunction. And I'm wondering, if something really needs to be done. I know that there are player council and player association. A kernel is taking form here, and it may come out next season where they actually have a proper association. But I really feel for the curlers here who are trying to plan for the Grand Slams and the Women's Worlds, and they don't have that communication. They're wondering what's going on.
Well, although we just had Brad and Carrie on the show, and Brad has felt that, the bubble has been perfectly safe up until now, and they want to make sure it goes forward. And I know as a curler myself, when I did see the plan last November, it did feel like a really solid, well thought out plan where you could only go from the hotel to the rink, et cetera, and all of the testing that went on in the early stage. It almost felt like you could reject going, which some curlers chose not to go into the bubble because of the uncertainty, or you could sign up for it, and most gladly and happily did. So I feel like in some ways, even with Nolan Thiessen being a former champ, that in some ways they do take into account how the curlers are feeling. And this is what they're doing it for, that, and I guess the broadcasting and the sponsors and things like that. But
well, it was interesting, Colleen, because I did ask Nolan, how do you think something like this could have happened? And the only thing he really brought up at all that makes sense is hotel staff.
Right.
And that's the one leak in that bubble that they have. And, how else could something get in there? It doesn't really make a lot of sense. unless, of course, somebody broke protocol. We haven't heard anything like that. So, there's no perfect bubble, obviously. They did a fantastic job. But the first 3 events, I mean, at the end of every event, I wrote about what a fine job they did in terms of, and not just Curling Canada and the people running the events, but the curlers themselves,
right.
in the sacrifice that they put in and the efforts that they put in to make sure that COVID-19 did not become a problem in their bubble. Well, unfortunately, it's only so good until it doesn't work anymore. And now we've found this spot where they're being hit with a real test.
So, Greg, do you think what they suggested, having now the next 3 events almost totally separate events, their own bubble, did that make some sense when they mentioned that on the conference call?
It did, yeah, a little bit. I'm still unsure about timing, though, and I asked whether even like a Monday finish for the men's worlds was possible, and it didn't sound like they wanted to do that at all. Yeah, like a non-starter, right? So, I mean, is there flex available with the Grand Slams? I mean, you don't want to push the women's worlds back any more than, I mean, we're already into the second week of May, right? Like you're asking a lot, and never mind the logistics of hotels and everything else and travel plans and whatnot.
And I don't know about you guys, but wasn't that the thing that sort of jumped out about the smallest margin of error between all of these events? I mean, they literally are leaving themselves 3 or 4 days to turn around the ice, put the new logos in. I mean, there was a very small margin of error, and now you're right up against it. And so that's my next question, though, is, we're about 12 hours away before they want to play these 3 games. What's going to happen in the next 12 hours? Colleen, you want to jump?
Well, you mentioned about changing the logos. Is that really a priority?
You better believe it.
Somewhere else, right? Can we put the Humpty Dumpty somewhere? I know, but
no.
Given extenuating circumstances of a pandemic, and they need 48 hours to turn around the ice to put logos in.
Why do you think any of these events are happening?
Exactly.
You could put the logos, you could put the signage. My goodness, it's incredible around the arena that I see all the advertising all the time. So there's lots of areas to put in some signage. It doesn't have to be embedded in the ice, does it?
Oh, I think it does.
Pandemic.
Well, there is, like Devin said, there is no event without the sponsors. There's no fans. There's no way to bring the people in. They have to be able to recoup the sponsorship money. So, I mean, I can't see why the Grand Slams would want to give that up. Now, there was talk about negotiation in terms of maybe pushing it back a little bit so that they could get this finished. But then what are you asking the curlers who've traveled here from other countries in some cases and all over Canada to be in Calgary, to go into that bubble and play in the Slam? And there's got to be testing for them too. And I'm certain there has to be some level of being, negative tests before they can even go on the ice. So, I mean, it's really unfortunate for all this that minuscule window that you mentioned, Devin, is right now when they've had positive tests.
Yeah. Greg?
I was just going to say, we know that television is the master at these things, curling and every other sport, but we're learning now that COVID-19 is really the master here. And we've got to just ride with it and adjust.
Okay, who's going to break the story that this thing's canceled? I'm kidding.
Well, I know who's going to tweet it first.
Listen, but back to my original question. Like I said, we're about 12 hours away before, literally, I think the cutoff line is. I mean, what update? Are we going to get an update? It sounds like we're not going to get an update tonight. How early are these updates going to happen? And does that even give enough time to prepare for these games, Ted?
I personally would be shocked if there were games tomorrow. I just don't see how it happens. It would actually be, in my opinion, if there's any positive tests, more positive tests out of the testing today, I don't see how you play tomorrow. And I mean, I just don't, maybe I'm being pessimistic, maybe I'm being negative, but it just doesn't compute for me that this is all going to work out and they're going to be able to play games tomorrow, regardless of the fact that Dr. Bob McCormack, who we all know and respect, said he's confident that they can play.
Greg?
I was stunned when he said that he was optimistic, that he was confident that curling would be back. I think it will be back at some point, but I can't see it happening tomorrow. If I had to bet, I would say we'll get a news release tomorrow morning saying it's postponed probably another day.
Yeah, I think
they got the Olympic berths in, didn't they? And I think that was the biggest thing out of this World Championship more than anything.
Well, it was huge. I mean, I think that in terms of Brendan Bottcher's team from Canada, I don't think that's much of a consolation for them that they were able to get into the top 6 and get that. They're obviously devastated that they didn't get any further than the qualification round. But realistically, for 2 years now, when they canceled the Worlds last year, a lot of the people in the know have been talking about how the heck do we get our teams qualified for the Olympics in 2022, and it's a very important thing for international curling. So at least, yes, they did get that part done, and that is good going forward.
Wow. Whew.
This was the hot stove.
A lot to unpack. Parting shots, Greg. Any last thoughts? It's been turbulent.
I'm stunned. It's taken until the 59th minute here to talk about, before we finally talked about Brendan Bottcher's quarterfinal exit. I mean, it's been a stunning 24 hours, and man, I mean, the top 6 thing, it's great that he got that spot for Canada. It'll be very interesting to see whether Team Anderson can do the same in a few weeks' time. I mean, the fields are so deep now. Colleen, be keen to get your thoughts on the women's worlds and just how tough it is to get that top 6 nowadays.
It is going to be just as tough in the women's side as we just saw on the men's side. I mean, this is wonderful to see I hate throwing out the word parity, but that there's such strength now. Going into this for the women's worlds, that it's going to be Canada, Sweden, Switzerland, Scotland, add in Korea and Japan. That's going to be tough to see who's not going to make it in this. And yet, at the end of the day, for the 6 that got in on the men's side, even though there was a little bit of panic, especially not just when Bottcher's team took a little bit of a slide, but for Switzerland to be just hanging on by the fingernails, I mean, that was certainly tense too. But it's funny you mentioned about we waited until the 59th minute to discuss Bottcher. It shows you in the news cycle.
Oh, yeah.
Our attention span is like, a dog chasing a squirrel, right? Like, it's like, okay, Bottcher. Sorry, Bottcher, we love you, but now this is the story.
Yeah.
We were all there, Colleen, Devin, Greg, we were all there at the media bench in 2018 in Pyeongchang at the Olympics, and we talked about it extensively. Where is this going for Canada when Canada did not finish on the podium, either men's or women's curling? And there was certainly some discussions about need for change because the world was catching up so much. Well, you just saw it again this week.
Yeah. Well, there was no change, really. The reality was, I mean, we have very talented curlers. I'm not saying that, but the world has caught up. If there's one problem with our Olympic process of deciding teams, it is that the trials are so late November, early December, to peak at that and then ask them to go to the biggest show on earth, the Olympics, 2 months later after you've just won the Roar, I think is too close. They have to move it to April to give those teams proper preparation.
I remember you saying that, Colleen, at the Olympics. Do you think that that's a possibility that's even being considered?
I think it needs to be considered, given the last Olympic went from 2 great teams, Cooey and Homan. I mean, those 2 are superstars, and the results didn't bear out to the team they are. When you're forcing a team to peak that high, like winning the Masters, and then ask them to do it again 2 months later, they're great. But man, that's a tough, you're climbing Everest twice in a real short span. But the curling calendar's busy.
Yeah, and we have about 10 months to discuss that, and we only have about 10 hours to discuss what's going to happen at the Men's World Curling Championship. Ted, Greg, awesome conversation, good perspective, and a lot more to come. Awesome to see you guys.
Thanks for having us, guys.
Thank you. Good night.
Guys. Wow.
Well, we covered it all, I think. We had a lot of different points of view and perspectives, and a little more clarity than what we had when we woke up this morning.
Well, more than anything, Colleen, and you and I talked about this a little briefly when we imagine what that curling show would be like. We've had a lot of fun. We've had a lot of laughs. It's been light through the Scotties and the Brier and the mixed doubles. we were also prepared that this could be a possibility, that we would have to talk about positive COVID cases inside the curling bubble. And so we hope for the people watching tonight that we were able to, like I said off the top, provide information, no hyperbole, no speculation. And tonight I feel like we did that. Great perspectives from everybody we had on the show tonight, Colleen.
Yeah, we thank all of our guests. We thank producer Soph too. And we thank everybody out there for joining us, and follow Devin's tweets because he'll know first.
I'm going to try and get some sleep tonight too, but we will be back tomorrow, of course, because there will be a lot more clarity in 24 hours. At least we hope so. We also hope that you're all staying safe, taking care. And thank you for tuning in to That Curling Show tonight.
Good night and stay safe. Thanks, producer Soph.